healthcare system is facing a crisis, with hospitals facing staffing shortages as the need for help only grows.
We told you the pandemic has pushed more people into our local nursing programs, and now medical schools across the country are getting a bump in applications. Meg Shaw checked in with a school here in Northeast Ohio, and Meg, we know at least one school is seeing huge interest.
Yeah, Northeast Ohio Medical University. They're located in Rootstown. They're one of 8 medical schools in our area, and a lot of graduates from that university end up staying right here in our area. And they say applications are up, but the efforts to keep that campus diverse continues. For the last 10 months, healthcare professionals have been in the global spotlight. Millions of doctors tasked with their usual job, plus navigating COVID-19.
We're really going to have to be smart about this in the future and understanding what capacity we need relative to utilization in the absence of a pandemic, and where do we need to place resources to be prepared for a pandemic.
But the reality is we need more doctors. According to the Association of American Medical Colleges, or AAMC, by 2033, the U.S. will be facing a shortage of 139,000 physicians.
I just reviewed our numbers, and we are at a 17% increase in total applicants.
That's Dr. John Langell, the president of Northeast Ohio Medical University, also known as NeoMed. He tells me, parallel with the rest of the country, in 2020, NeoMed saw an increase in first-year applications. However, their institution saw very little growth in diverse applicants, something Langell says needs to change.
We're all competing to increase our diversity because it is the right thing to do. We need to do a better job in having a healthcare workforce that's reflective of the population of patients that we take care of.
He's calling for efforts to start at the elementary and middle school level, especially for those from disadvantaged backgrounds.
Sometimes it's just as simple as providing that role model early on to say, here are opportunities for you. And if those role models are not available to you where you're from, you may not even think about that as part of your future professional opportunities.
The other issue at hand, medical schools aren't increasing their capacity fast enough, despite 30 new institutions opening in the last 2 decades.
It helps provide a bigger pool of candidates and hopefully a more diverse pool of candidates. It doesn't necessarily increase our physician numbers for the future. That's something that's going to require more effort in other areas.
Langell calls the problem a bottleneck issue.
Well, we can double the number of students sitting in a classroom without any difficulty. It's the number of clinical training slots in hospitals that that's the barrier.
Now, Langell says they're also working to make NeoMed more affordable. They were actually just awarded a federal grant, which will give them 32 half-tuition scholarships every year for the next 4 years. And he says those scholarships will be awarded to students who have the least amount of resources to pay for med school. Danita?
All of that is necessary and very good, Meg. How is NeoMed working to increase their underrepresented student population?
Well, Danita, they actually have a new program on their campus. This is for underrepresented students in that population who may have just missed admission getting into the university, maybe because of their MCAT score. So NeoMed implemented a new pathway program. It's a 1-year master's degree program where these students will be taking the courses at NeoMed, and if they pass, they will then be awarded full admission into NeoMed without having to retake the MCAT test. And they tell me actually 80% of the students enrolled in one of the programs there at the university this academic year are from that underrepresented student population. So big changes there at the university, and big things are happening in the medical field here in Northeast Ohio. Reporting live, I'm Meg Shaw, News 5.
Also new this morning, we're sharing the details behind a new law.